Did you know that you can create your own heaven for those with epilepsy while on earth? All it requires is knowledge, organization, and compassion. So welcome to Mental Health and Science with Enock Francis. Today we are going to look at how you can create a safe home, how you can take care of a person who has epilepsy at home. If you are still new to this channel, I request you to subscribe because it motivates me to make more videos of this nature. So the first thing you have to know is that you have to educate yourself, okay? You have to know what epilepsy is. So like in my previous videos, if you have not watched about epilepsy, I request you to go and watch, because I have taught you what causes epilepsy, what are the signs and symptoms of epilepsy, and the things that you are supposed to avoid in epilepsy. So what we are saying in this test that you have to know, you have to clearly know what is epilepsy is, and we have said that epilepsy is a brain disorder which makes someone to fall down, convulse, and here we have different types of epilepsy. There is a convulsive type where someone convulses, and also a non-convulsive type. So knowing epilepsy or educating yourself about epilepsy helps you to know how best to support your patient at home. Okay? So if you have not watched that video, I request you to watch it because it has more important information for you. Then number 2 is that create a safe environment for your child or your person with epilepsy. Okay? What are we trying to say is that at home, make sure that the environment where these people are staying is safe. Okay? Remove the sharp objects, remove the pangas, remove the knives, remove any sharp stones around, because in case they get an attack, these objects can harm them. So to reduce the injuries that those people can get is that we have to say remove the sharp objects which are found within their reach. And also we are saying that if you are in a house, we need you to have a carpet, a soft carpet, okay? Especially where these people spend most of their time. In that, when they have a soft, you have a soft carpet in your house or a mat, when they get a seizure, when they fall down, their heads will not be what? Will not be damaged so much. So you reduce the physical injuries. Okay? So we are saying create a safe environment by removing any objects that can cause injury to this person. Try to use pillows at home, if in case where these people are staying, use those soft mats. These ones reduce the physical what? The physical injuries. Then number 3, we are saying that create a routine. Okay? Ensure that you have a routine for daily activities. Okay? Ensure that these people are having meals at the same time. If you want to have breakfast at a certain time, you continue maintaining that time. Okay? If you have meals at 7 p.m., we want you to maintain that time of giving of eating that food. Okay? If it is some physical exercises maybe which people are doing, ensure that those things are done on timely basis. Why are we saying this? Because these activities, when the person of epilepsy knows that these things are done routinely at specific times, it encourages them, or like they get assurance that they have safety. It reduces their stress. You know, when someone is stressed, it can trigger a seizure. So we are trying to avoid those triggers. Someone is worried about food, is worried about what time am I going to eat. So we are saying that you create a routine, even a routine of giving medication. If, for example, if you are giving medicine in the morning, maybe at 8 a.m., maintain that one. If you are giving also in the evening, maybe at 6 p.m., we say maintain that routine so that they get used to this what? These routines. Then another thing we are saying that encourage drug compliance. So ensure that your patient takes medicine at the right dosages. Okay, if your doctor said that you should take medicines at maybe in the morning hours, ensure that this person takes medicine in the morning hours and the right doses. Okay, so there are sometimes when caretakers, they panic when someone gets an attack. Like if someone is convulsing maybe 5 times and they have told you to give 2 tablets in the morning, 2 in the evening, you find someone giving more tablets than they are supposed to what? They are supposed to give. So If a person gets an attack, don't give overdose of medicine. So give the right the medicine that they are supposed to get. When you properly give the right medication, this one helps the controlling of the seizure, that someone does not get attacks. So wherever you are watching us, from Uganda, from South Africa, from Kenya, USA, UK, wherever in the world, please, I request you to subscribe to our channel, because it motivates me to make more content for you. Number 5 is that there's what we are calling emergency preparedness. Okay, so if you have someone who has seizures, always be prepared. They can be on treatment, but there are certain things that can trigger someone to have an attack. Like for example, sickness. Like if someone has severe malaria, has severe infection, they can trigger, and you find this person having what? Having epilepsy. So we are saying that be prepared for emergency, and know if you don't know how to give first aid to a person with epilepsy at home, there is a video that I have made on how to give first aid to a person with epilepsy at home. So go and watch it, because it has good information for you. Then also you ensure that you have enough medicines at home during the medicine that you give to your patient with epilepsy, and also ensure that you have enough medical records at home. In case he gets an attack, you are able to carry them and take him to the in the hospital. So ensure that you have a contact with your medical personnel, because they can advise you on what to do. Number 6, we are saying that ensure regular checkups. Okay. There are some people, when you treat them very well and their seizures are controlled, they forget to go to the hospital, they forget to go and see their doctors to continue monitoring how medicine is doing. So regular checks are very good, because they help the medical worker or the health worker to find out whether these medicines are controlling the seizures, and also to find out which kind of side effects is this patient experiencing. So it is very good for you to take your person for regular checkups. Then lastly, we say, I would say that these people require emotional support. So always provide emotional support, because when you get a seizure, it is always embarrassing. Okay, so ensure that you talk to these people, you counsel them, you provide them with social support, you care for them, because this one encourages them. Sometimes people with epilepsy develop depression. Okay, so we encourage you to support them with social support, to encourage them. These are not the only ways of supporting someone with epilepsy at home, but these are some of the tips that I can give you at this point. And for more tips, I request you to get in touch with your doctor. He can give you more tips on how to care with someone of epilepsy while at home. But if you don't have one, I have my number on my screen there. You can see it, and I'll be glad to support you. And thank you so much for watching my videos. Please, if you are still new to this channel, I request you to subscribe, because it motivates me to make more content for you. Thank you.